Well, it's a pleasure to be here. I figured if the presidential candidates can come to New Hampshire, I can come through as well. What I'd like to do is very briefly run you through an overview of the study that we did. I'll try and keep it to 10 or 12 minutes. Keep in mind that we did a forum on this at the Institute last month that lasted an entire day. There's still lots of unanswered questions, so I'm going to give you a brief overview. Really, what we were trying to do was to quantify what was at stake, to put a better understanding that rising rates of chronic disease are one of the primary factors that are driving healthcare costs higher in the United States. So that was one of the principal objective research pathways. So first of all, we looked at what does chronic disease currently cost us. We looked at 7 chronic diseases, 7 of the most expensive in terms of treatment costs, and all of them, to a greater or lesser extent, have a prevention element associated with them. So that was one of the underlying things we looked at. So we looked at the people with reported cases, the treatment costs, and then the lost productivity and work days associated with those that were afflicted. We found that 109 million Americans report having at least one of these 7 chronic diseases, and there are a total of 162 million cases. So there's comorbidities. The person has diabetes and also hypertension and heart disease. Then we kind of looked at where's the current course taking us in terms of our behaviors, what's happening to obesity, smoking rates, and what does that mean for chronic disease in the future if we don't change the course that we're on. Then we also looked at an alternative case. What if we made improvements in prevention and treatment, where we look at if behaviors are changed in terms of nutrition, smoking, other unhealthy behaviors, how much could we change or prevent cases of these chronic diseases and avoid future increases in cost of treatment. And we also looked at this at the state level, came with some estimates of population reported condition and treatment expenditures at the state level. And then we also looked at some of the intergenerational effects. So here you get into some of the more detailed statistical implications of this in terms of looking at the econometrics of statistical relationship between chronic diseases and educational attainment and how that affects the overall growth in the economy. This wasn't a principal focus of the study, but some of the conclusions and potential public policy issues that needed to be addressed in the study. So you have a copy of the PowerPoint and I believe some of the executive summary of the research findings. There's also a much more voluminous document that any of you have insomnia, it will cure that. So just print that out. It's over 200 pages. So there's lots of more detailed things in there. This first shows you the 7 chronic diseases that we looked at in the study. This is the number of people reporting each of these chronic diseases. You can see pulmonary conditions, which includes asthma, was the most prevalent, all the way down the list, diabetes, cancer, stroke. We made a lot of improvement in terms of longevity for people suffering from cancer or heart disease. So there have been tremendous improvements, but on the other hand, we have some real challenges. We've seen a dramatic increase in the percent of the population diagnosed with diabetes and associated cardiovascular diseases, and a lot of this has been driven by rising rates of obesity. This shows the associated treatment costs of the 7 chronic diseases. In total, in 2003, which was the latest year we had data for when we undertook the study, now the 2004 data is out, not too different from what we estimated, but about $280 billion in treating these 7 diseases. And you can see heart disease was the most expensive, and cancer. Diabetes was at $27 billion, but this doesn't include the follow-on health effects, some other comorbidities, some of the hypertension, heart disease could be assigned back to initially diabetes. Also doesn't include amputations associated with diabetes or blindness that results. So there are a lot of other costs that could be included in the diabetes estimates. Now there's another cost that's typically not thought of. The treatment cost people understand, but there are costs to American business as well. The treatment costs are really just the proverbial tip of the iceberg, because chronically ill workers take sick days, reducing their supply of labor and therefore GDP, but they also suffer from presenteeism. In other words, you're at work, but you're not performing up to your normal standard. This is typically called presenteeism in the literature. Basically, it means you have lower productivity, which is actually the largest impact overall. Also, the loss of labor supply from caregivers, those that are helping take care of someone that suffers from one of these chronic diseases, typically isn't included in the estimates, which we did in our estimates here. And when you do that, you see that hypertension is the highest in terms of the economic cost in the economy through lower productivity. And some have asked, well, how could that be? It's about cancer. The difference is this is the employed population. There's roughly 30 million employed individuals that have hypertension. There are about 5 million that have cancer. So if you look at it on a case basis, cancer is by far the highest overall. The hypertension, because the prevalence is so high, and you see that diabetes moves up the chart as well. So then we looked at the future. Well, it's fine to document what does this cost today in terms of direct treatment costs, also the lost productivity, but what can we do to change the future? The future is not deterministic. So first we looked at the aging population. The first baby boomer actually applied for Social Security 2 weeks ago. Think about that. So there's a demographic tidal wave on its way, and the prevalence of these chronic diseases increases dramatically as one ages. A woman between the ages of 65 and 74 has a 10 times higher risk of contracting breast cancer than a woman under the age of 50. For prostate cancer, for men, it's even higher. It's over 100 times larger. So we're facing the demographic tidal wave on the way. When we looked at the underlying behavioral risk factors and some other demographic factors, and then also included, we had earlier screening detection, such as in the case of colon cancer, how many cases could be avoided, and then projected that out in the future under a couple of different scenarios, a baseline and optimistic. This busy chart, I know it's hard to read from the handout. So we looked at all the different behavioral risk factors that are associated with these diseases. Weight control, obesity, overweight, improved nutrition, exercise, smoking rates, and also some environmental factors such as urbanization, congestion, to look at, if we continue on the current path, where are we likely to end up in 20 years, versus an alternative path where we actually change our behaviors and improve many of those behaviors. And what we found is that there's some relatively modest changes in behaviors, such as reducing obesity rates, and what, for example, the obesity assumption that we have in the optimistic scenario has the obesity rate in the United States going back to where it was in 1998. Now we remember what 1998 looked like. So from that perspective, it would not appear to be too much of an optimistic projection, but if you actually compare it to where we're headed and our current trends, it would appear to be very optimistic. So it's important to keep that in mind. But after doing all the calculations, we found that we could avoid or prevent 40 million cases of these chronic diseases within 20 years by changing our behaviors.